I think AUGUSTUS trial is extremely important. I think that it will really educate us and teach us how to take care of patients who have atrial fibrillation, who are also undergoing either a percutaneous coronary intervention or have an acute coronary syndrome. And for the first time, we have a randomized trial that is both comparing different types of anticoagulants as well as antiplatelet therapy versus no antiplatelet therapy.
I think with the addition of AUGUSTUS, that's now the 4th trial, so that I think we've established a new standard of care that we're really getting rid of triple therapy and going with a full dose novel anticoagulant and a P2Y12 inhibitor as the optimal approach for patients who've had PCI and have atrial fibrillation.
The trial tells us that apixaban appears to be safer than warfarin or Coumadin, and you do not lose anything in terms of efficacy. And if anything, there appears to be a significant reduction in death or hospitalizations as well. In terms of aspirin, as expected, aspirin versus placebo is associated with more bleeding, but there was no benefit either. So I think it's really important to put this together, right? For the first time, we have a trial that will really help us take care of these patients. We know that apixaban is safer, and it's probably a little bit more efficacious depending upon which outcomes you're looking at. And aspirin really does not provide any potential benefit. So I think this will really help the practitioner figure out how best to treat their patients.
This study is unique in having a formal 2x2, so it teases out the benefit of the novel agent and of aspirin, and each contribute in slightly different ways, but then reaffirm that really dropping aspirin gets rid of lots of bleeding, and the novel anticoagulant reduces dramatically the hemorrhagic stroke risk, and so both of those together make this really helpful. And then the thrombotic events were very similar despite dropping aspirin, so this really is a win all around. And when putting that together with the 3 prior trials, then we have now the 4th time the same answer of getting rid of aspirin as the right answer for these patients. It's a little nerve-wracking for interventionalists to take away something we've used our entire careers, but now we have a lot of evidence supporting it, so we can look to that and a very robust, large trial here to say this is the right thing after all.
I think guidelines are important. I think guidelines are important when taking care of lots of patients. As a practitioner, I think that you are able, or one should be able, to synthesize their data as soon as they sort of understand what new data shows. I think trials such as this one, I think can be utilized already, right? We are taking care of plenty of patients who have AFib, who also require either single or dual antiplatelet therapy. And I think this trial will go down as really helping us take care of patients and to sort of figure out differences between clotting and bleeding.